Welcome to our channel. This video is on comprehensive overview of diabetes. In this video, we'll cover every basic thing you need to know about the types of diabetes, their demography and epidemiology, signs and symptoms, how type 2 diabetes is acquired, complications, prevention strategies, and medications. Diabetes is a chronic metabolic disease characterized by elevated blood sugar or blood glucose due to the body's inability to use it as energy in the cells. This leads to multiple symptoms and, if uncontrolled, can lead to serious complications. There are two main types, type 1 and type 2 diabetes. Some pregnant women may develop a temporary type called gestational diabetes. This usually resolves after delivery but may often require management during the pregnancy. Prediabetes is when the blood sugar level is higher than normal, but not to the level to be diagnosed with diabetes. This usually resolves with conscious lifestyle changes. First, a brief note on insulin. Insulin is a chemical produced by a special type of cells in the pancreas called beta cells of islet of Langerhans. This chemical acts as a key to open the body's cells to pick up sugar or glucose in the blood to be used as energy. Type 1 diabetes is an autoimmune condition where the body's immune system attacks the insulin-producing cells in the pancreas. This type is less common and usually diagnosed in children and young adults. While about 90% of people with type 1 diabetes have no family connection with the disease, certain genetic factors can predispose people to developing type 1 diabetes. However, genes alone is not enough to cause someone to develop the disease. Type 2 diabetes, on the other hand, occurs when the body becomes resistant to insulin or the pancreas doesn't produce enough insulin. This type is more common and often associated with lifestyle factors. Family history of type 2 diabetes certainly predisposes someone to developing the disease, and lifestyle factors makes it possible. Globally, the prevalence of diabetes is rising. According to the World Health Organization, approximately 422 million people worldwide have diabetes, with type 2 diabetes making up about 90 to 95% of cases. The prevalence is highest in low and middle-income countries. Type 1 diabetes is more common in individuals of European descent, while type 2 diabetes is more prevalent among people of African descent, Hispanics or Latinos, some Asians and Pacific Islanders. Now let's talk about the signs and symptoms of diabetes. Common signs and symptoms of diabetes include increased thirst and urination. Excessive thirst or polydipsia and increased frequency of urination or polyuria may be the first signs of diabetes. The increased urination is usually worse at night, disturbing your sleep. Unexplained weight loss. With diabetes, the body is unable to access and use the blood sugar or glucose as source of energy. This makes the body first use stored energy in the liver called glycogen. It next breaks down body fat as source of energy. This may make you lose weight. This is, however, a late sign of the diabetes when the blood sugar level is so high. Extreme fatigue. Because the body is unable to use the blood glucose as source of energy, you may feel tired all the time. This may also be an early sign of the disease. Blurred vision. Another late symptom of diabetes. The high blood sugar begins to destroy the small arteries in the eyes. This condition, called diabetic retinopathy, is progressive, and if the diabetes is not controlled for a long time, can lead to total blindness. Slow healing of wounds due to the high blood sugar is another late sign and symptom. This may lead to amputations if wounds in the legs are unable to heal and get frequently infected. Frequent infections. The high blood glucose level causes inflammation in the body and also reduces the body's ability to fight diseases. Frequent boils or abscesses may be present. Numbness in the feet and hands. Nerves in the feet and hands get less sensitive as the disease progresses and the blood glucose gets higher. You may develop wounds in the friction points of the feet without noticing them. This is called diabetic neuropathy. Let's now talk about how type 2 diabetes is acquired. Type 2 diabetes is acquired through a combination of genetic and lifestyle factors. A sedentary lifestyle, poor diet, and obesity significantly increase the risk of developing the disease. Family history and age also play crucial roles. Let's now see some of the complications of diabetes. If left unmanaged, diabetes can lead to serious complications such as cardiovascular diseases. Having uncontrolled diabetes means you are likely to develop other diseases such as hypertension. This puts you at high risk of developing heart disease and eventually heart failure. Nerve damage, also called diabetic neuropathy as discussed earlier. Kidney damage, also called diabetic nephropathy. Eye damage or diabetic retinopathy as discussed earlier. And last but not the least, foot problems, potentially leading to amputation. How do you prevent type 2 diabetes? Preventing type 2 diabetes involves lifestyle changes. Maintain a healthy weight. Eat a balanced diet rich in fruits, vegetables, and whole grains. Exercise regularly, aiming for at least 150 minutes of moderate exercise per week. Simple exercise as regular walking does wonders in fighting diabetes. Avoid tobacco use. Limit alcohol intake. And regularly monitor your blood sugar levels if you're at risk and feel any of the symptoms mentioned earlier. Let's end by talking briefly about some of the medications your doctor may put you on if you are unlucky to be diagnosed with diabetes and how they work. For type 1 diabetes, insulin therapy is essential. For type 2 diabetes, several types of medications are available. Metformin reduces glucose production in the liver. Sulfonylureas stimulate the pancreas to release more insulin. An example is gliclazide. DPP-4 inhibitors help reduce blood sugar levels by stopping the liver from producing more sugar when not needed. An example is sitagliptin. SGLT2 inhibitors help the kidneys remove glucose from the bloodstream. An example is dapagliflozin. Finally, insulin therapy may sometimes be necessary for advanced type 2 diabetes. Always consult your healthcare provider to find the best treatment plan for you. Thank you for watching our overview on diabetes. Remember, preventing and managing diabetes is a lifelong commitment, but with the right information and support, you can lead a healthy and fulfilling life. Don't forget to like, subscribe, and share this video with others. And please don't forget to check out our other videos on other important health conditions. Stay informed, stay healthy,